Hello, everyone. It is now 3:01. I just wanted to give a couple minutes, maybe one or two more minutes. We have quite a few people still logging in. For those of you just joining, please indicate your agency and your name in the chat box so we can capture our audience today. We'll get started at 3:03. All right. It is 3:03, and I would like to be mindful of everyone's time. I see there's about 92 people here, which is fantastic outcome. So I wanted to welcome everyone. This is our pre-bid workshop for Riverside County fiscal year 2024 Continuum of Care Program Notice of Funding Opportunity. And this workshop is non-mandatory. However, we have highlighted that it would be extremely helpful for any of your staff agencies to attend to get a better understanding of the process for the HUD competition and entering new project applications into eSnaps. We could go to the next slide, Zuli. And just a couple of housekeeping items. This workshop presentation will be recorded and posted to our CoC website, along with a copy of the slide deck. And those will be posted within the next day. So probably tomorrow morning, we'll have that up and ready for you guys. And we ask that you type all questions you have today in our workshop in the chat box. And what we'll do is we'll address as many questions as we can at the end of our presentation. All questions and answers to this workshop will be posted to our website 2 days after following this meeting. Go to the next slide. And then just a quick welcome and introductions. I would like to introduce Tanya Torno from our Housing and Workforce Solutions team to give an opening statement to all of our prospective applicants. Tanya, if you're there.
Thank you, Jamie. Good afternoon, everyone. It's good to be in a room full of people that care about this work as much as we do at Housing and Workforce Solutions. I want to welcome back our renewal agencies who have continued to work with us. Some of you for the first year, you're coming back for your second year. Many of you have received HUD CoC funding for many years, and we recognize that these program dollars require a lot of coordination and accountability. And so for that, we are thankful that you continue to show up and help us meet a local need. To new agencies that are here, I'm seeing a lot of new names, new faces. We want to also acknowledge your courage and interest in wanting to do more. We know you're here because the number of calls and inquiries that you receive for assistance are above and beyond what you can provide. And so you're looking at ways to be able to expand your reach. As always, we are very interested in using these program dollars, which you will learn more about in just a second, to strengthen our existing homeless delivery system. Many of you may recall that in 2022, our Homeless Continuum of Care adopted a homeless action plan. And in that plan, we agreed to move from just funding individual projects and individual missions to instead funding projects that collectively work together and use a systems level approach to coordinate care for people who are experiencing homelessness across our entire county. So what does that mean? It means that we are regularly leaning on each other, that we have each other on speed dial, and that our teams are in constant communication. So when our teams come across a person, I always use the name Johnny, that your street outreach teams are working together with other street outreach teams to troubleshoot and identify resources that Johnny needs at that immediate point in time, and that you're working together to call a shelter provider within our system of care to identify a housing placement, and that you're even following Johnny through into what we call as rapid rehousing program or a permanent supportive housing program, but essentially following Johnny through all the way to the finish line where he is able to sign a lease agreement and live in independent housing. And so to, again, make that work, it means that we regularly have to show up together, that we lean on each other, because we recognize that we're all in the same plane, we're all in the same boat, whatever, an analogy you want to use, but we recognize that in order to end homelessness for that person or for our entire region, it requires us to work together. So if it is your goal to work together in that fashion collectively, then you are at the right place. We want you at the table. And my hope is that your project applications will reflect this and speak to the different pieces that your projects will be able to deliver on to make our huge Titanic move. So again, as always, thank you for joining us. We need you, and we're excited to have you here today.
Thank you, Tanya. I also have myself listed on here. I'm one of the senior program specialists here with the Continuum of Care team. And we also have Catherine Wormley, who is another senior program specialist on our team and is also going to be overseeing our HUD Continuum of Care program. You could go ahead and go to the next slide, Zuli. Today's agenda, the items that you see here will outline our presentation and provide some overview items in addition to HUD requirements and local process information and system navigation. Next slide. So what's new this year? Some of the changes that have been made that HUD's made us aware of is changes to tiering. Tier 1 is now set at 90% of the continuum's annual renewal demand, or what we call the ARD. And in 2023, that was actually 93%. So it's a bit more beneficial for our scoring, showing that we can, put Tier 1 projects set at 90% instead of the 93. And then the big thing that is a huge plus, we hope that HUD is going to continue this every 2 years, is now a 2-year notice of funding opportunity. So the Consolidated Appropriations Act that they passed in 2024 authorizes HUD to issue a single 2-year NOFO for fiscal years 24 and 25. So what that kind of looked like, what it looks like is with these project applications and new projects that we're going to see come across, those budgets and funding requests will still reflect a 1-year request, but in fiscal year 25, they're going to do sort of like an auto renewal that we did back in 2020 during the pandemic. So we'll still do our normal 1-year 2024, but come next year, we're not going to have this big competition process and all of these items that we have to do to prep in advance. It'll be a bit more streamlined and they'll do auto renewal for those. And then of course, if we do have new projects, then we'll go through the new project process. And then also one of the big changes that's nice to see, and I'm going to explain it a little bit further on, is cost of living adjustments for conditionally selected grants. So again, with that Appropriations Act of 2024, it's authorized HUD to make reasonable cost of living adjustments to the renewal amounts. And again, these are for renewal projects to help afford increasing costs of operations due to inflation. So I'll explain that in a few more slides. And then also, sorry about that, Zuli. COCs may also apply for the DV bonus projects where the total amount for 1 year of funding for all DV bonus applications is set to 15% of a PPRN, which is a preliminary pro rata need. And last year that was actually at 10%. So the amount has increased on that for that change. Oh, we can go to the next slide. Sorry about that, Zuli. So HUD's homeless policy priorities provides additional context to help applicants better understand how the selection criteria supports the goal of ending homelessness. So what you'll see on this screen is 1 through 4 of those policy priorities. Under 1, to end homelessness, COCs should identify, engage, and effectively serve all persons experiencing homelessness. They should also measure their performance based on local data that's considered the challenges that are faced by subpopulations that are experiencing homelessness in a geographic area. And then we also look at partnering with housing, healthcare, and supportive service providers and agencies to expand housing options, such as permanent supportive housing and rapid rehousing. That second item is use for housing first approach. And that says that we want to prioritize rapid placement and stabilization in permanent housing and utilize housing as a platform for providing supportive services that improve a person's health and well-being. Funded projects under this program should also help individuals and families move quickly into permanent housing without preconditions and ensure that the participants can choose the services that they need to improve their health and well-being while remained housed. And the third item is reducing unsheltered homelessness. The number of people experiencing unsheltered homelessness continues to rise, and with that, including the number of encampments in many communities that are across the country. So the COCs should also explore all available resources, including COC and ESG funded assistance, housing subsidies, healthcare programs, and other supportive services to help improve unsheltered people's well-being. And we should also be using our coordinated entry process to promote participant choice, coordinate homeless assistance, and mainstream housing and services. And this fourth item is improving system performance. The COC should be assessing the performance of all homelessness projects using system performance measures, such as average length of homeless episodes, rates of return to homelessness, and rates of exit to permanent housing destinations. You can go to the next slide. You'll see 5 through 7 here, partnering with housing, health, and service agencies. We would want to maximize the use of mainstream and other community resources when serving persons experiencing homelessness, and we should work closely with those healthcare systems and agencies and assist program participants to obtain healthcare and supportive services, including behavioral health services and those covered and financed by Medicaid. We'll also want to look at partnering closely with our public housing authorities and state and local housing organizations to utilize coordinated entry, develop housing units, and provide housing assistance to people experiencing homelessness. And number 6, with racial equity, HUD is emphasizing the system and program changes to address racial equity within COCs and projects. Responses should address racial inequities and ensure successful outcomes for all persons experiencing homelessness using proven approaches, such as partnering with racially diverse set of community partners and people experiencing homelessness, and also partnering with organizations with experience serving the underserved populations. And item 7 is improving assistance with the LGBTQ plus individuals. We should address the needs of our LGBTQ plus, our transgender, our gender nonconforming and non-binary individuals and families in their planning process. And when considering which projects to select in the local competition to be included in the consolidated application, we should also ensure that our projects provide privacy, respect, safety, and access regardless of gender identity or sexual orientation. And we'll go to the next slide. This has items 8 through 10. Number 8 is persons lived with experience or expertise. And these are people who best know what solutions will effectively end homelessness and are those who are experiencing homelessness. Our COC should include people with lived homeless expertise and experience in their local planning and decision making processes. And COC leaders and community partners should prioritize hiring people who are experienced homelessness in areas where their expertise is needed. Item 9 is building an effective workforce. And this is from our previous slide about the cost of living. So, homeless assistance providers will need well supported staff to provide high quality assistance. And HUD is finally hearing us on that. So, HUD is applying a cost of living adjustment to supportive service activities and other staffing focused budget line items to allow COC budgets to better keep up with rising costs. And again, these are going to be for our renewal projects. And also, COCs will work with funders and other community stakeholders to improve pay and support for people who work for the homelessness sector. So, again, with that cost of living, that will be automatically adjusted to our budget line items after we submit project applications, similar to what HUD does when they review FMR for rental assistance. They're going to go ahead and automatically apply that adjustment to those budgets. So we won't need to account or do any sort of calculation for that. And then item 10 is increasing affordable housing supply. Our COC should be communicating with jurisdiction leaders, including for the development of consolidated plans, about the harmful effects of the lack of affordable housing, and they should also engage local leaders about steps such as zoning and land use reform that would increase the supply of affordable housing. Our notice of funding opportunity will award points to COCs that take steps to engage local leaders about increasing affordable and accessible housing supply. And we can go on to the next slide. The slides that will follow this, we will be discussing our available funding and detailed bonus information with preferred coordination and competition timelines. Go to the next page, which shows our available funding. So from the U.S. Department of Housing and Urban Development, they have made approximately $3.5 billion available nationally under the CoC program. And the table that you see here are the funds that will be available to Riverside County, which include our estimated annual renewal demand at $14.7 million, our continuum of care or COC bonus at $2.1 million, and our domestic violence DV bonus at $2.6 million. So if we go on to the next slide, this is going to explain the annual renewal demand. So that ARD at 14.7 million is the estimated of all of the COC projects that will be eligible for renewal with this program competition. And that's before any required adjustments to funding for leasing, rental assistance, and operating budget line items based on FMR changes. So within that annual renewal demand amount includes 19 projects that are eligible for renewal in the County of Riverside. The next slide is going to talk about our continuum of care or COC bonus, which is at 2.1 million. The COC bonus of 2.1 is what the county can competitively apply for towards creating one or more new projects, which is 12% of the final pro rata need, or what we consider our estimated annual renewal demand, or the preliminary pro rata need, whichever is higher. So that's how HUD gets this calculation and generates those dollar amounts. The COC may receive up to 14 points on our application if the priority listing includes new project applications through reallocation or the COC bonus that utilizes housing vouchers and healthcare provided through an array of healthcare service providers. And so those project applicants can apply for projects such as permanent housing, permanent supportive housing, permanent housing rapid rehousing projects, joint transitional housing and permanent housing rapid rehousing component projects, dedicated HMIS projects, which is our HMIS lead agency, and our supportive services only coordinated project by our coordinated entry lead agency. We can go to the next slide. This will talk about our domestic violence bonus of 2.6 million. And this is what the county has to competitively apply for towards creating new DV bonus projects up to 15% of its pro rata need, which is the amount the CoC could receive based upon the geographic areas. These will be new rapid rehousing projects and supportive service projects providing coordinated entry and for eligible activities that the Secretary deems to be critical in order to assist survivors of domestic violence, dating violence, sexual assault, or stalking. To be considered for this bonus, the project must be, again, that rapid rehousing project or a joint permanent housing rapid rehousing project, and the SSOCE projects, which is our coordinated entry project that we have. You can go to the next slide. This is our coordination with housing.
Oh, Jamie, you may need to turn off your camera. The connection is a little weak.
We can go to the next slide.
So Jamie, you cut off there for a second. Do you mind?
Sorry, Zuli, can you hear me?
We can hear you. Can you hear me, Jamie?
I'm so sorry. Can you guys hear me?
We can't. Can you hear us?
Hello? 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 Hello?
Yeah, Jamie, we can hear you.
I can't hear anybody. I'm so sorry.
Just a minute, guys. We're gonna try to work with you. And then you're logging.
Spreads out, and you learn to you self-medicating. You might.
Jamie, can you hear us now? Okay, we might need to give it a minute. Thank you guys for your patience. Roshana, maybe if you can suggest to Jamie if she can maybe log off and log back on, sometimes that works.
Hello?
Yes, can you hear us?
A man who helps around the house.
Hello?
Yes, can you hear us?
We can
Oh
hear
my
you.
goodness. Yes. I can hear you guys. Can you hear me now?
Good. Yes, we can hear you too.
I'm so sorry.
It's okay. It keeps the bidders conference fun. So the good thing is more people have logged on. So the pause may have been
Yes.
good, but we're here and we're happy that you guys have remained patient with us throughout this process. So Jamie, we'll turn it back to you.
Thank you guys. Thank you very much. I apologize for that. So yes, this if you go to the next slide for me, Zuli, this is still in connection with our coordination with housing and healthcare.
Jamie, would you be able to repeat this slide because we weren't able to hear you when you started this one?
Oh, sure.
So we missed the information.
Sure.
Thank you.
No problem. So for this one, the Consolidated Appropriations Act has directed HUD to provide incentives or basically more points in our application to create projects that coordinate with housing providers and healthcare organizations to provide permanent supportive housing and rapid rehousing services. And for leveraging housing resources, COCs that apply for at least one new PSH or RRH project that utilizes housing subsidies or subsidized housing units not funded through the CoC or ESG programs. So we're definitely looking at those projects that are providing more coordination, more partnership system-wide. Could you hop to the next page for me, please? Thank you. So again, with coordination with housing and healthcare, housing subsidies or subsidized housing units may be funded through any of the following, which would be private organizations, state or local government, through the use of home funding provided through the ARPA or American Rescue Plan Act, public housing agencies, including the use of a general or limited preference, faith-based organizations, or federal programs other than the CoC or ESG programs. We also want to see that they demonstrate the housing units in the case of permanent supportive housing, providing at least a 25% of the units included in the project. And then in the case of rapid rehousing, we would serve at least 25% of those program participants anticipated to be served by the project. And also with this coordination, they want to see those letters of commitment to demonstrate the number of subsidies or units that will be provided to support that project. We can go on to the next slide. And we talk about, again, the demonstration of that written commitment from a healthcare organization. So in the case of a substance use disorder treatment or recovery provider, it will provide access to treatment or recovery services for all program participants who qualify and choose those services, or the value of assistance being provided is at least an amount that is equivalent to 25% of the funding being required for the project, which will be covered by the healthcare organization. And those formal written agreements would include the value of the commitment and the dates that the healthcare resources will be provided. So for those that have renewal projects or are familiar with some of our funding, this is very much similar to, like a match letter. And the coordination with housing and healthcare is that extra bonus or incentive that CoC is given by HUD. We can go on to the next slide. And so reallocation is one of the items talked about in the NOFO, and that is a process COCs use to shift funds in whole or in part from existing eligible renewal projects to create one or more new projects without decreasing the annual renewal demand. COCs may only reallocate eligible renewal projects so long as the renewal project that's being reduced or eliminated has a current grant agreement and has renewed under the program at least once. So first-time renewal projects would not be eligible for any sort of reallocation. And then the COCs can apply for the following types of new COC projects, which we've talked about earlier on, those permanent supportive housing projects, rapid rehousing projects, joint transitional housing, rapid rehousing component projects, dedicated HMIS, and also our supportive service only coordinated entry project. We go to the next slide, which talks about consolidation. This is a process by which two or more projects eligible for renewal apply for funding and are combined into a single renewal project upon award. For renewal projects consolidating during this funding process, the current period of performance and budget must have an end date in calendar year 2025. So the start date for that consolidated grant, if it was conditionally awarded, would be the day after the expiration date of the eligible renewal project with the earliest expiration date. I know it's a lot to say, it's a mouthful, but we can look at that further into the NOFO. They go on to explain that if you are interested in consolidation. We could go to the next slide, which talks about expansion. and this is the process used by eligible renewal project applicants to add funds to an existing CoC renewal, DV renewal, or a YHDP renewal project to expand its current operations, either through reallocation, DV bonus, or CoC bonus project applications. And HUD will allow project applicants to apply for new expansion projects to expand existing projects to increase the number of units, persons served, services provided to existing program participants, or to add additional activities to the HMIS and SSOCE projects. We can go to the next slide. This talks about match. Match is regulatory, and that's under our Code of Federal Regulations 578.73. This requires that recipients must match all grant funds, except for leasing funds, with no less than 25% of funds or in-kind contributions from other sources. And please note, because HUD typically includes a slight increase in its award, to cover that increase in fair market rent, we usually discuss a 30% match of the project application amount, and that's to be recommended just to avoid any rework for our match letters for our applicants. And then, of course, cash and in-kind resources will satisfy the match requirement. All costs that are paid for with matching funds must be for activities that are eligible under the CoC program, even if the recipient is not receiving CoC program funds for that activity. Match resources may be from public or private resources. You can go to the next slide. New project grant terms. So these are for all of our new project applicants. HUD will allow these new projects to request 1 year of funding with a longer initial grant term that's not to exceed 18 months. HUD has determined that most new projects requesting 1 year of funding normally take about 3 to 6 months to begin fully operating, and therefore a new project requesting 1 year of funding may request a grant term of 12 months to 18 months that will allow for the additional startup process. So again, that's only going to be for that initial first year of operations, and then moving forward thereafter will be 12 months rolling. And then the next page is a lot of information for you guys, but this is our timeline of events that we have done and are to come. We did our letter of intent for our renewal projects back in June. You could see today we have our non-mandatory pre-bid workshop. And within 2 days, we will be posting the responses to any questions that we receive from this meeting. And then we are also releasing our request for proposals today. So this release will be posted on our website. We will also send this out through our CoC email, but that will be released after this meeting today. And approximately 1 week after we release, we will also be posting questions and answers from the RFP release. And I apologize, it says RFO, but on September 4th, we should be giving you guys questions and answers that are related to the RFP. And posting it will be September 6th. September 4th is when that would be due. So you guys have 1 week to ask any questions from that RFP release. September 18th will be when our request for proposal is due. Our submission deadline would be by 1:30 p.m. Pacific Standard Time. That gives you guys 21 days for this application period and will allow us to make sure that we have our local review process done and we get our recommended funding to our board. You'll see a couple of dates moving forward to be determined. We're going to have our special Board of Governance meeting, which is the first week in October, as well as our CoC notification to project applicants, where we would notify all of our applicants of whether they were approved or rejected. And then the application completion, our continuum always wants to make sure that we submit ahead. So we would like to submit our application by October 28th, just in case we run into any technical issues like what I just had where I couldn't get back into this meeting. So we want to give ourselves that 2-day grace period to make sure we hit that deadline of October 30th for when the submissions are due to HUD. And if you guys have any questions for this timeline, just please make sure that you're emailing our CoC email. We're going to be reviewing that inbox highly just to make sure we address all of your questions. And I'll go on to the next portion, which is our local evaluation process. And this is going to be our independent review panel. They will be convened of non-conflicted members to review proposals that have met the minimum eligibility threshold criteria. They will meet to score and rank each project application using the criteria that we've given them. And the result recommendations will be presented for approval in our next Board of Governance meeting for inclusion in the 2024 competition consolidated application. So again, kind of talking about this, I know previously there's been questions if they received an acceptance letter from the continuum of care for their project. Please know that that's an acceptance letter at the local level, and what happens after that is the project will be included in our consolidated application to HUD. And then HUD will be the deciding factor of the projects that are to be awarded. And if so, those dollar amounts and budget line items. So there's kind of a 2-level approval process, I guess you could say. So you'll receive a local letter of acceptance to be included in that consolidated project. And then we hear from HUD once they make those final award decisions. The next slide will detail the minimum threshold review. This talks about our eligibility thresholds and what it is comprised of. We found that both our new and renewal projects should all meet the same minimum threshold review, and that includes our HUD CoC priorities and Hearth Act requirements that HUD is mandating. So that's why this list looks a little bit longer than previous years. That is to include those Hearth Act and CoC priority recommendations and requirements from HUD. We can go to the next slide that will show you guys the request for proposal scoring. So the independent review panel will award a point value to each new and renewal project application, and that's going to be using a 120-point scale. So you'll see here the renewal projects is going to cover system performance measures at 20 max points, program compliance at 40 points, fiscal compliance at 30, and HMIS compliance at 30. And then you'll look at our new projects, which will include applicant experience at 10 points, project design for housing and services at 30 points, system compliance for 20 points, fiscal management at 30 points, and HMIS compliance at 30 points. We can go to the next slide. This is going to talk about our local preference bonus points. So these points will be given to project proposals that meet the following criteria for additional consideration, which has a max point value of 20. We'll look at master leasing, projects that may be for permanent supportive housing. We're also going to look at applicants, the applicant agency that is partnering with a new organization who has not yet received CoC funding previously in an effort to build agency and system-wide compliance. So we're definitely emphasizing that partnership to build capacity within our jurisdiction. And then applicant agency is partnering with other public housing and healthcare service agencies under this proposed project. Again, huge coordination points. HUD wants to see us coordinating with housing and healthcare service agencies. So this will be a local preference bonus point as well. Final award selections are usually announced and made by HUD in early to mid 2025. I would say probably between January to maybe end of February, early March is when we should hear our final awards. And of course, as always, the county will reserve the right to split or make the award that is most advantageous to the county. And this slide just lists some resources for you to use, which include our competition website page. You'll find the recording and the slides to this presentation in addition to several other HUD resources for the competition and detailed instruction guides for eSnaps. If you're not already familiar with eSnaps, I highly recommend that you view those instruction links to assist in the completion of your applications. And you'll also see step-by-step within the request for proposal and have an opportunity to ask any questions that you need during that first week after our release. And then any additional questions after this workshop, please make sure you are sending them to our CoC email. We do have to be very fair and make sure that we are only responding to the questions we receive from our CoC inbox. So as we've mentioned before, please make sure you reach out to us. Our questions and answers will be posted to our website. We will continue to make all of our announcements through our CoC email as well. And I've also included our last slide, which is a thank you for attending. I know that you guys have all bared with me during my issue, so I appreciate it. Please know that myself and Catherine are going to be your key contacts throughout this process, and you can reach us at our CoC inbox for questions with the RFP. But we also have our emails here in case you need to reach us directly about other items. So I want to open it up at that point. I know that there were some questions going on in the chat, Zuli, that I thank our team for responding to. But are there any questions in here that we haven't addressed yet?
Someone asked to go back to one of the slides, so I'm going to do that right now.
Okay, sure.
Was this the slide,
Mm,
Chris?
Sorry, I'm looking for that. Go back to the slide that shows points for new projects, I think is what you're talking about. So so this is the slide. This would show new projects and how we're going to score each of those areas based on a 120 point scale. I know a few people were asking if the slides will be available. I will have them up before you wake up tomorrow morning. I'm going to be working with Zuli to post some of our items along with our RFP. Of course, my RFP is the priority to make sure we get that to you guys within a few minutes after this meeting. And then we'll be posting the recording of this as well as the slide deck.
I believe we have a question from Jillian. It says, for new projects, what is the latest date a contract could start to be eligible under the FY2024 NOFO?
Sure. So there is a gap in time as far as when HUD makes the announcements and then when they give us what we call the grant agreements that show final budget line items. What we would like to advise is that new projects start mid-year. So somewhere around, we're going to say July, June of 2025, just so that there's not a gap in time. What we find with some of our renewal projects that we can't really get around at this point is a project starts January, February of this year, and their new renewal project doesn't come out and we don't get a grant agreement executed until mid of that year. So the agency's kind of having to float funding to operate that project until they have an executed contract with us. So it would be recommended, it would be best if we could try to get projects to start in the mid-year, June or July of sometime. Let's see.
Allison has their hand raised.
Oh, sorry. Go ahead, Allison.
Yes, hi. I had a follow-up question to what you just asked, Jamie, and then a second question, if you don't mind, that I had when I first raised my hand. I know it would be ideal, as you said, for the contracts to start July or June, but I'm just curious if there are new projects that are currently under construction or under development that will have their own construction timelines. Is there sort of any wiggle room with those types of projects, and what would be sort of the drop down deadline for consideration of those types of projects?
So when you're saying construction timeline, are you? I'm a little confused by what you mean.
So if like, let's say as an example, a new PSH facility is currently under construction, but it won't be ready for lease up until, let's say, September of 2025. Is that new project still eligible to be considered, even though the contract start date would more likely be closer to that September 2025 start date?
There shouldn't be an issue with that as far as the start date goes, being in September, so long as the project starts in the calendar year 2025.
Okay, thank you.
I'll make sure that I keep track of the questions and make sure that I can get more of a concrete, solidified answer for you on that. I just want to make sure that I answer that 100%.
Appreciate that. Thank you. And then my original question was in regards to the slide about bonus points.
Okay.
So you had mentioned master leasing is 5 points, and then PSH is another 5 points. What about master leasing PSH projects? Would those be considered a 10-point project, or is there sort of a subtext to those different categories that we should know about?
Yeah, I can speak to that.
Sure.
So we were definitely intending to differentiate between the two projects. So we will make sure that before the NOFO is posted and emailed out to everyone after this meeting that we clarify. So it would be one or the other, right? So if you're a developer of permanent supportive housing projects, then you could get the 5 points for administering a project. And then we would be looking for agencies who have master leasing agreements with private landlords and property management companies, as an example, to set aside specific units for clients that they would directly sublease with. So we'll make sure to clarify that in our notebook. Great question.
Thank you. And I think the other clarity that might be helpful is the terminology of organization. You had mentioned like new organizations. Can that mean, a plethora of different entities, or is there sort of a, specific type of, are you looking just for other homeless service organizations, or, what if we're bringing in other types of service providers in different sectors into the program? Would that be considered for those additional points?
So I'll speak to the intent of the question and the reason why the additional points were added is really to help build the capacity of other homeless assistance agencies that already engage and participate within our homeless continuum of care, but may have not or have not yet administered HUD CoC funding. So there is a very, very specific interest to looking at who is already administering homeless assistance programs and how do we help build their capacity, their reach, to help them, become a partner in this field. So great question. We'll make sure that there's specific language in the NOFO that speaks to that.
Great. Thanks, Tanya.
Thank you, Allison. Looks like there was another question about seeing a list of descriptions of new projects that were funded. Uh, Unfortunately, HUD did not fund the 4 or the 5 projects that we submitted last year, 2023. Those were accepted at the local level, but HUD did not award any new projects um, for us. So I'm not sure maybe if you're interested to see the types of projects we have, Chris, or if this is related to another reason for your ask. If you're not able to mute yourself, you can always respond in the chat if you have more. Okay, types of projects. Okay. Sorry, there was a couple messages that came through. Okay. So types of projects, you're saying permanent supportive housing projects. We're seeing our rapid rehousing projects. A current new project that we have is a rapid rehousing project for our veterans. So it depends on, if you would like to have any of those conversations as far as what types of projects that we have funded. I'm not sure, Tanya, how we've done this before in the past. Looks like a few people are wanting to see the descriptions or the current projects that we have.
I apologize. I was multitasking and responding to another question in the chat. But they're looking for, no, that's okay. We're working and we're wanting to make sure we respond to all of your inquiries. So could you repeat that again? Individuals are asking for.
Yeah, they're wanting to see a list or descriptions of the new projects or a list of the current projects that we have. And I'm not too sure how we can share that information. I mean, it's not private information. We do post it on our website.
Yeah.
If it's posted on your if it's posted on your website, can you just post the link to that? I'm new to this, and I'd be curious to see some information about what you have approved, at least on your end in the past.
Absolutely. Yeah. So we do have a list of all the agencies that have received funding through previous rounds. It shows the activity types, the amounts. So Jamie, I'm thinking about right, the priority listing or the review and ranking list that we submit to HUD.
Yes.
So we can share that with participants on this list. Happy to do so.
Yes, and Emma, Emma just put the link for our open bids, division, and funded programs section of the continuum of care. And if you scroll on that area, you'll see our previous funding and links, which will show the different announcements and listings that Tanya just mentioned that are a requirement for us to post to the community. You're welcome. Okay. Sarah, you're saying also, did HUD deny those applications last year? The new project applications, unfortunately, were not awarded. When HUD makes those announcements, there's not necessarily any sort of detailed response as to why they're denying us a project. They just simply show what's funded and what's not. All we can do is take our HUD consolidated application and look at our scoring, which we do receive that, and we do a comparative report to determine where our weaknesses were in any responses. But they don't give us reasons for each individual project that's submitted. Mary
projects were.
Oh, sorry. Go ahead.
Sorry. You said some of those that weren't awarded last year ended up being funded locally.
No, so that's where like the confusion comes, because what we do is we have our RFP process that, there's a closing date, then we have our independent review panel that will review them and score the projects, and then we'll look at our priority listing to determine the projects that will move forward and the projects that we are accepting to be included in our consolidated application. So those projects that will move forward to be included will receive a letter from the CoC that says your project was accepted. There's no funding tied to that at that point. It's just letting you know they've been accepted. And then we submit our consolidated application to HUD, and HUD will be the ones who will award the projects.
Okay, so they were accepted through your agency, and then did they end up getting any sort of funding?
No, unfortunately, the new ones that applied last year did not get any funding from HUD. There was no award made, so the project was not funded.
Okay, I thought you had said that you rerouted and found other sources of funding at a local level.
Oh no, I apologize. They're not that I'm aware of.
Oh, okay. So that's also a
Yeah,
likelihood for this round as well, right?
absolutely, yes. So this will get approved at our local level, and then HUD makes the final decision.
Got it. Thank you.
Sure. Let's see. Looks like I have two hands up. I don't know who the first person was. Okay, Carol? Carol,
Hi,
you
can
had
you
your
hear me?
hand up? Yes.
Okay, yeah. So I'm calling in because I joined a little late. I was having some signal issues. But so I'm reaching out because is there any specific programs that are more likely to get chosen over than others, or areas of concerns that are higher priority than others?
Um, it all goes back to the notice of funding opportunity and what HUD is going to incentivize at the end of the day. Those items and priorities that we talked about at the beginning of the slide, and you may not have been on the call at that point, but there's 10 different priorities that HUD looks at. So just wanting to kind of follow those expectations that they have. I couldn't really tell you that they would approve one over another um, for one reason or another. Like they're not going to, approve a PSH over rapid rehousing just because, but they do have priorities and incentives for certain criteria.
I think
Hopefully
what I would add to that is that HUD has priorities, but then also as we've spoken about, our local continuum of care has outlined priorities within its homeless action plan. And so to the extent that we could, we are providing additional points that support or incentivize projects that are providing permanent supportive housing because we recognize that we have a big need for more beds to, on an ongoing basis, serve individuals who are chronically homeless. So to that end, if you are interested in doing permanent supportive housing on a local level, that is a priority. We are looking to increase those beds because one of our local goals is to reduce the amount of time that it takes to link people to a housing unit and reduce the length of time that they stay on the street or experience homelessness. We also included extra points for projects that have master leasing arrangements with property managers, property owners, with the idea that with these arrangements in place, it quickly or reduces the amount of time that it takes for a regular property owner to do a screening on a person and get an approval for that person to sign a lease and move in. And then we have points that also support agencies who are partnering with an existing homeless service provider that has not yet received HUD CoC funding, but could use this partnership to help build their capacity, because we recognize that on a regional level, on a county level, we need to build our capacity, and that means working with newer or smaller organizations to help them expand their reach. And if there are any other points, Jamie, that I may have missed, please feel free to jump in.
No, thank you. Those are good. Thank you for that. Susan, you have your hand up?
I do. I had to have my hand up. You know that.
Hello.
Okay. Hi. So I have two questions. One, for the master leasing, how long will HUD pay for a vacant apartment? So in between clients, how long do you have before they don't pay for it?
It's a 90-day period.
Okay, that's great. Okay, my second question is, does HUD still look at the, obviously, I haven't been around a while. I have new questions that are old questions. Does HUD still look at the staff operations ratio to client services? Is that still a big issue to them?
When looking at our annual performance reports, that is something that is definitely reviewed at the closeout. So at the forefront, yes.
Okay. They used to literally be specific in their NOFAs, and I didn't see it in there anymore, but I sort of figured it was understood that you don't want to have a whole bunch of weight into your operations and your staff versus your clients. So, okay.
Yes,
Thank you.
absolutely. Yeah, you're welcome. Any other questions that I might have missed? No? All right. Zuli, if you wouldn't mind just going to the last slide so that everyone can see our contact info one more time. We will be working on our RFP to make a couple of slight adjustments to provide clarity to those bonus points that Allison talked about. Thank you. And then we will be releasing that today before 5 p.m. And yes.
Jamie, hi.
Yes.
I don't know if you answered Mary Trupp's question.
Oh, I'm sorry.
And then there's another one down here, Sarah Mejia. So I'll read off Mary's question. When you mentioned all these projects, is it money to help clients with rent?
Yes. So we would be paying a portion of money on the behalf of the client to the landlord for those permanent supportive housing or rapid rehousing projects. Of course, rapid rehousing projects is going to be your short-term, medium-term, not to exceed 24 months of rental assistance. So yes, so those are to help individuals continue to stay housed.
And then Sarah Mejia had two questions. The first one was, did HUD deny those applications last year? And then the second question, is there a recommended staff to client ratio?
Okay. I did discuss the first question. And then the recommended staff to client ratio. Not sure if we have a recommended ratio. I'm not sure. I saw one of our lovely managers, Brandon Trahan from our fiscal team on. I might put him on the spot if he's still on here.
Hello, I am.
Hi, Brandon.
Hi. So a recommended staffing ratio, I mean, that's always a little difficult to pin down because every project is different, serves different needs and different populations. But that's definitely something that Jamie, that's a great question, I think, and one that I want to make sure that we do focus on in our projects to make sure everybody, is able to be successful. So, Jamie, I think As we work through this process, can we work to maybe see in your experience what would be good ratios for those and maybe provide some guidance there?
So,
Yeah, definitely.
so
I can include this in our question and answers, Sarah, and this will be posted by Friday. What we do is we kind of collect all of the questions that we've had and anything additional that we get in our CoC inbox. So we'll make sure that we include this information in there for you.
I do know for the HUD YHDP, it was recommended 1 to 15.
Okay. Thank you for that, Roshana.
Thanks.
And then
That's the
you had another
recommendation.
question. Thank you, Roshana. And another question, would funding ever be approved for property acquisition, for example, through auction? I wish, but I haven't really seen any sort of type of funding with HUD Continuum of Care dollars for that or for infrastructure in general. That's where you're going to probably see that coming more from our state dollars, possibly HAP, or any other special type of funding opportunities that come out. And then, I mean, we do have our county arm that has other projects and our CDBG, our community development block grants that provide infrastructure, but not for this program,
And Jamie,
unfortunately.
yeah, I will jump in and agree with you that historically, at least through the HUD Continuum of Care program, there's been very little incentive for continuums of care to apply for development type of projects or to receive funding to support the development of affordable housing or permanent supportive housing projects. However, about maybe 3 weeks ago, HUD did release a continuum of care builds NOFO that is or does directly support the development of permanent supportive housing. We will be sharing more information. Our plan is to put together a local request for proposals, and we'll be holding a very similar bidders conference to this one for that one. So I would encourage everybody here to keep an eye out for it. Again, it's called CoC Builds, and there's about $175 million available nationwide. So I know it sounds like a lot, but I want you guys to really know that HUD intends to award 25 communities across the nation. So it is very, very competitive. And our CoC is eligible to receive up to $7.5 million. So we're definitely going after it. We believe that we are a competitive region and there are a lot of good projects that could make us successful in acquiring those dollars. So more to come. It is new and we're very happy that this is being offered to CoC. So we shared on this during our last CoC meeting and we'll be sharing more in the very near future. Thank you.
Thank you. All right. Any other questions that I may have missed? Thank you. When you mentioned other possible sources, was HAP one of them? Yeah, so HAP was kind of an example of what I'm talking about of other specialized type funding that may, come down from the state to provide infrastructure. But yes, HAP, it's Homeless Housing Assistance Program, HHAP. Sorry, too many acronyms. Any other questions for now? I know questions probably will come up after this meeting, so just make sure you email us at coc@rivco.org. All right. I think I will conclude. It was a pleasure presenting information to you guys. I'm glad everyone stayed on for the entire duration. Please stay tuned. We will be releasing the RFP shortly today. and then you are off. We thank you guys again for joining us. Enjoy your rest of your day, and we will be in touch.
Thank you.
Thank you.
Yes, thank you so much for joining us. Felt like we had a CoC meeting. There were so many participants on
Thank
the call.
you.
So thank you.